Today's medical-centric topic is Persistent Sexual Arousal Syndrome. Everything you need to know. Persistent Sexual Arousal Syndrome, PSAS, also known as Persistent Genital Arousal Disorder, PGAD, is a rare and distressing condition characterized by spontaneous, persistent, and uncontrollable genital arousal that occurs without sexual desire. Understanding its causes, symptoms, diagnosis, and treatment is essential for managing this challenging condition. 1. What is persistent sexual arousal syndrome? Description: chronic arousal. PSAS involves ongoing genital arousal that is not linked to sexual thoughts or activity. Symptoms: can last for hours, days, or longer, and can be extremely distressing and uncomfortable. 2. Causes of persistent sexual arousal syndrome. Neurological factors: nerve damage. Damage or irritation to the pudendal nerve or other pelvic nerves can lead to PSAS. Spinal issues. Conditions affecting the spinal cord, such as cysts or herniated discs. Vascular factors. Blood flow changes. Alterations in pelvic blood flow can contribute to persistent arousal. Medications. Drug side effects. Certain medications, including SSRIs, antidepressants, have been associated with PSAS. Other factors. Hormonal imbalances. Changes in hormone levels may play a role. Pelvic conditions. Pelvic varicosities, infections, and other pelvic disorders. 3. Symptoms of persistent sexual arousal syndrome. Physical symptoms: genital arousal. Persistent feelings of genital fullness, throbbing, or tingling. Lubrication and swelling. Involuntary genital lubrication and swelling. Emotional and psychological symptoms: distress and anxiety. Significant emotional distress and anxiety due to persistent symptoms. Depression. Feelings of hopelessness and depression as a result of chronic discomfort. 4. Diagnosis of persistent sexual arousal syndrome. Medical history and examination. Symptom assessment. Detailed documentation of symptoms, their onset and duration. Physical exam. Examination of the pelvic area to rule out other conditions. Neurological evaluation. Nerve testing. Assessing the function of pelvic nerves. Imaging studies, MRI or CT scans to identify any spinal or pelvic abnormalities. Psychological assessment. Mental health evaluation. Screening for anxiety, depression, or other psychological factors. 5. Treatment of persistent sexual arousal syndrome. Medications. Pain relievers. Medications to manage pain and discomfort. Antidepressants. SSRIs or other medications may help alleviate symptoms in some cases. Topical anesthetics. Creams or gels to numb the genital area and reduce arousal. Therapies. Cognitive behavioral therapy, CBT, to manage emotional distress and develop coping strategies. Pelvic floor physical therapy. Exercises and treatments to address pelvic floor dysfunction. Medical procedures. Nerve blocks. Injections to block nerve signals and reduce symptoms. Surgery. In rare cases, surgery may be considered to address underlying anatomical issues. Lifestyle adjustments. Stress management. Techniques such as mindfulness, yoga, and relaxation exercises to manage stress. Avoiding triggers. Identifying and avoiding activities or situations that exacerbate symptoms. 6. Managing persistent sexual arousal syndrome. Support networks. Support groups. connecting with others who have PSAS for shared experiences and support. Counseling. Professional counseling to address the emotional impact of the condition.
Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.